Welcome, everybody. We are here to manage our anxiety within ourselves and our patients. I am Ryan Rutar. I am a clinical dental hygienist. Um, I would like to thank Voco tonight for putting this show, I guess you could say, on. And I am from Nebraska. This is me in the white. I own a consulting company as well off to the side. So I was a past state president for Nebraska. I was award recipient to the Changemaker in Dentistry for 2023 by Ondium. My master's is in business management, more focusing on the management part and understanding people. And then I also like to be a creative force through humor and understanding to help change people's lives. So as far as past experience on like, well, how do I know about anxiety? I was diagnosed with generalized anxiety because I was a small town kid in a population of 308 in Nebraska, raised by my grandparents in a 1950s home. And I came out as a gay kid later on when I turned 21. So as you can see here, this is my husband of 11 years, soon to be 12 in January. So I guess we're closer to 12 than we are 11. But I try to help dental offices because I'm a full-time, like I said, clinical hygienist, but I help dental offices with expanding their knowledge as far as LGBT and anxiety, and work with hygienists to help become better clinicians and work with the dentist in order to create a cohesive environment because I manage the hygiene department at Morning Glory Dental. So what we're hoping to learn today is we're going to manage anxiety by recognizing different parts of the brain responsible for this behavior. So that way we know what's happening. Then we'll also identify the different medications that affect these parts of the brains. They can either enhance, complement, or interfere with our anxiety. And then, of course, we want to apply strategies to enhance ourselves as well as the individuals that we treat in order to make patients feel more comfortable because dental anxiety is very high amongst a lot of patients. So speaking of anxiety, it is probably the highest mental illness within the US, affecting over 42.5 million people. This was just in 2023 for Mental Health of America. In 2021, it was 40 million, so it's already gone up 2.5. And then mental illnesses was at around 47 million, and it's already gone up to 50 million. So we're not decreasing our mental illness or anxiety within the US by any stretch of the imagination. And it's only, I have a feeling, going to get worse until we start understanding and dealing with these types of issues. Anxiety is very highly treatable, but only about 36%, 37 receive treatment for that anxiety disorder. And it can develop from genetic brain chemistry, personality, and life events. I kind of had a cluster of them all because my mom has mental disorder or mental illness. And then, so I kind of have maybe a little bit of brain chemistry, but then also life events kind of created a situation. So I've had depression and anxiety, and it shows that half of those that are diagnosed with depression usually have in some form of an anxiety disorder. Well, mental health, we know, doesn't discriminate. I know some of you may know who this person is. So it's Ryan Reynolds, actor for Deadpool. His main thing is anxiety, so he advocates for medication, but then also the app Headspace, which is kind of helps with meditation and getting into a peaceful state. He once said that if there was the Olympics for anxiety, he would win a gold medal. But I feel like I could challenge him to that, so the Ryans would be doing it. We also know that this is Lady Gaga. She's a singer, songwriter, actor, and she suffered from anxiety and depression. She may still have a little bit of anxiety. The depression happened more when she was early young adult time period. And so that's why she advocates for the Born This Way Foundation for young adults, because that's when she found it to be most helpful for her. And then finally, one of the top athletes and one of the most award-winning Olympians, Michael Phelps, he suffered from depression, anxiety, had thoughts of suicide because basically after he was done swimming, he didn't necessarily take a look inside as to who he was without swimming. And so it affected his mental health. So as you can see, there's all of these people within the world that can suffer from these types of issues, and it's not just someone around the corner. So types of anxiety, we have generalized anxiety disorder, which I mentioned is what I have. It affects about 6.8 million people. We have panic disorders, social anxiety disorders, which is SAD, which is probably the most at 15 million. And then specific phobias is about 19 million. Now, this is where dentistry or dental phobias occur, and the onset for these phobias is around age 7. So, pedodontists, you have a big job in front of you. Then we have obsessive compulsive disorder. I'm sure there's some dental professionals out there that kind of fall under this. And then we have post-traumatic stress disorder, which is about 7.7 million. Surprisingly, you would think that with post-traumatic stress disorder, you usually think of military individuals, but the highest PTSD actually comes from rape, which is kind of sad to think about. But again, so dental professionals have this rare opportunity where we get to see our patients every 6 months. We get to build those relationships, create the trust. And what that allows for us to do, though, is see change within individuals, whether they come in the same way that they normally do, or if something seems a little off, we get to be on top of it more so than a lot of other professionals see. And so it'd be great as dental professionals if we were kind of on top of helping them to find the resources that they need. Not necessarily be their therapist, but to give them the resources to help reach therapy if they need to. So the brain, we have the frontal cortex, which is kind of the logical side. That is the lighter blue area. That's kind of where our intelligence comes from. That's where they say, you need to use your head. That's that outer part. And then we have the gut part, or the limbic brain, or they can call it the lizard brain, which is more of the central part of the brain that basically is where a lot of our evolution areas have occurred. And so this is our kind of fight flight response area. There's also the left versus right cortex to think about. Now, your left side is associated more with like logic, reasoning, analysis, ego, judgment. And then your right side is associated more with like body language, imagination, more the creative aspects. And we know this because there was a neuroscientist named Jill Taylor in 1996 who popped a blood vessel on her left lobe, and it caused a lot of her left lobe to shut down. And so a lot of her thoughts were then controlled by her right side of her brain. And she realized that she felt inner peace far more than she'd ever had in her whole life. And a lot of it was because of our dominant left brain that's very analytical thinking and telling us what we're doing wrong was kind of silenced. So basically, in order to find inner peace, all you have to do is a lobectomy to your left lobe and you're good to go. Yes, that was sarcasm. So we have the limbic brain, which is that inner part. And we kind of want to focus on that because this is where the fight or flight or anxiety is starting to come from. So we have the thalamus, which is the cream area in the center. This is kind of our scanner. So it's looking around, taking in all our senses. So sight, sound, smell. And then we have the amygdala, which is the little purple lobes on either side. Those basically take in the information from the thalamus, and it goes then straight to the hypothalamus, which is that little green area, which then has a lot of neuron clusters that go straight into the brainstem, which then activates the sympathetic nervous system. But the main thing that we want to talk about is the amygdala. So the amygdala is responsible for a lot of the anxiety that we experience. It's responsible for 5% of the conscious brain activity that we have, but 95% of unconscious brain activity. So that controls the release of the hormones. It controls the physical symptoms that we have. It can also control rage and emotion, and also memory-based issues. And so people are like, well, what do you mean by emotional memories? And this is an example where there was this doctor who wanted to figure out if we have memories elsewhere besides in the outer shell of our brain. And so there was a woman who was suffering from Korsakoff syndrome, which is a memory disorder associated with alcoholism. So she couldn't remember one day to the next. It's kind of like 50 First Dates with Adam Sandler. And basically what he did was he went to shake her hand, and he had a pin in his hand. And as he introduced himself and shook her hand, he pricked her hand. And so, of course, she pulled back because there was pain associated with that. Well, the next day he did the same thing where he went to introduce himself, and she didn't remember who he was. She had no idea. And he's put his hand out to shake her hand. And as she started to reach for his hand, she recoiled before his hand touched hers. And so that proved to him that there was an unconscious emotional memory somehow linked, that's not based on our outer cortex. So we have this amygdala then that is creating these emotional memories, these unconscious memories that we don't necessarily have control of, and that's where some of our anxiety is coming from. Amygdala, it's technically divided into two lobes, but they say that it's one entity, and it kind of comes from the Greek word meaning almond. And so we kind of want to focus on two today, the lateral part of the nucleus and the central part of the nucleus. So the lateral part of the nucleus is that blue area in the brain, and it is like the thalamus, where it's the receiver of incoming messages. It senses and looks around for danger, scanning everything to make sure that we're okay. And then finally, once the lateral nucleus takes in information, it sends it to the central nucleus. Now, the central nucleus is what is responsible for the direct connection to the hypothalamus and the brainstem, which then activates the sympathetic nervous system. So all of this occurs where it goes from the thalamus sensing something to the amygdala, to the hypothalamus, to the brainstem, all before it even hits the outer side or the cortex. So this neurological synapses that occurs within all of these activities has a higher dense structure compared to what the thalamus will then visualize and get out to the cortex. And the reason why we know this is that you can think of it as when you're walking around your office and one of your employees or one of your coworkers jumps out and scares you, you automatically jump because that anxiety pathway has already occurred before you realize, oh, this is just one of my stupid coworkers. And so then you realize that you're not in danger. And so that's when the sensory part then gets finally to your cortex and the logic can kind of start to kick in. So we have these two sympathetic nervous systems, sympathetic versus parasympathetic. And so the sympathetic nervous system is the anxiety side, where it's part of our fight or flight response. And then you have the parasympathetic, which is the opposite, relaxer, stimulates saliva and digestion. And so when we have anxiety, we want to try to activate the parasympathetic, which can usually be done by breathing in deeply. And so that's where breath starts to come in, is that we're trying to shut down the sympathetic nervous system so you're not in your fight or flight mode. Now, it has changed to fight, flight, or freeze. And that's another thing that they've noticed in people, kind of like when a rabbit sees something, it'll freeze in order to not get noticed. And so you either run from danger, you fight it, or apparently now you can also freeze, locking your movements. And all of that occurs faster again before we even realize what's going on. But it also explains why some people have anxiety and they can't explain why they have anxiety, because it's an emotional memory rather than a memory that can be dictated through language. So if we're going to be talking about meds, we kind of need to understand what they're going to be affecting. So this is a normal neuron. The dendrites are off to the far side at the very, very top. They take in and receive the signal. Then it travels down the axon, which is that long little bumpy thing. And then it ends at the synapses, where it connects to another neuron. And that's where then the message, when it has enough positive charge of the neurotransmitters, then it'll fire. So it starts at dendrites, follows down the axon, goes to the synapses, then their dendrites pick it up and it continues to flow in that direction. So the neurotransmitters that occur in that gap or the synapses are dopamine, norepinephrine, serotonin, and GABA. There's probably more, but these are the main ones that you want to focus on. So dopamine is more of your alertness, but also can be pleasure, motivation. They say that you get that from a running high. I have yet to experience that, but then we have serotonin, which is more your relaxation, your pleasure, but we also have a lot of serotonin in our digestive tract too. That'll come into play later. And then we have norepinephrine, or as a lot of people know it as epinephrine or adrenaline, which is kind of responsible for your fight or flight arousal response. So the neurotransmitters, remember I said there was that synapsis where it goes all the way down and then attaches to another neuron. And so the neurotransmitters will build up in that synapsis and then they'll release. And so then that's how the other neuron will absorb, or the dendrites will absorb those neurotransmitters. And of course, they're responsible, for releasing hormones, our well-being, happiness, digestion, appetite, all that fun jazz. So if we want to change the anxiety we experience, obviously we need to change the neural connections that lead to these anxiety responses. So for your viewing pleasure, you are welcome. I've come up with kind of a fun way to remember medications, because I hated pharmacology and learning it in school. So we have benzodiazepines, which Ben and Pam will be responsible for. That's Pamela Anderson and Ben Affleck. Then we have the SSRIs and the SNRIs, which Irene Ryan will be responsible for. And we have beta blockers, which Betty, laughing out loud, Betty White will be responsible for. Now, some of you are like, who's this Irene Ryan? Which I thought it was cool that she had the last name Ryan, but you'll also recognize her as the Beverly Hillbillies grandma. So Irene, or you can use Irene Newman. I don't care. Just remember the "ine" part, the I-N-E, Irene, when it comes to these medications. So we'll start with benzodiazepines. So if you'll notice, a lot of the generic names end in Pam, except for Xanax, which ends in lamb. So I guess you could think of her hair as being curly, lambish, whatever. But again, a lot of them end in Pam, and then they're called benzos, which would be like Ben Affleck. So they have immediate relief for anxiety, and can also help with insomnia as well. So how do the PAMs work? Well, they calm the fear response through increased GABA receptors. But when you block those GABA receptors, it actually blocks the neurotransmitters of the amygdala. And so the amygdala will not have any memories, because of the fact that you're actually decreasing and inhibiting the amygdala from working. So that reduces your fear response, like the escape, freezing, and sweating, and increased heart rate. However, also, there's a lot of GABAs in the brain. It's about 1/3 of the connections. And so therefore it affects then your muscles. And that's why you have sometimes impaired concentration. So if someone is on benzos, that's why you're like, well, we need someone else to drive for you, because you're affecting more than just anxiety, but a lot of the brain in itself. So the problem with Ben is 4 to 6 weeks can already result in a psychological dependence. So they're kind of addictive. Withdrawal symptoms can occur if taken off of it too fast. And so what you're trying to avoid will obviously then increase. That's why you'll have anxiety and headaches and agitation. You can have long-term impairment if you're on this for a long period of time, including verbal learning and also your memory. So you have memory impairment if it persists, and even after you stop taking it, that memory impairment can persist even further. So as I tell people, Ben and Pam, not necessarily good for a long-term relationship, just maybe one night or so. And they're really good for specific indications. Like if someone is very nervous about having a filling done, then you could be like, okay, well, let's, take a Xanax. But I don't know that I would be too big of a fan of taking it for insomnia, because again, this is going to be addictive and something that can cause memory impairment. So I think it's more of a specific situation rather than it used all the time. So now onto your selective serotonin reuptake inhibitors and then your serotonin norepinephrine reuptake inhibitors. Now these actually are helpful. So they all end in enes and rams. So you can think of Irene riding the ram. Now the only rams that occur are further generation of selective serotonin inhibitors. So you had Celexa and then Lexapro. So Lexapro is the newest and least amount. So a lot of your patients take escitalopram. There's a lot of people that are on escitalopram, and you need to remember it as a RAM. So the Irene is on the RAM, and so that's selective serotonin reuptake. And then of course the other ones like Effexor, Cymbalta, those are in the purple, and those are serotonin and norepinephrine reuptake inhibitors. So how do these enes work and rams? Well, they block the process of reabsorption. So if there's too many neurotransmitters that are sent out, then the synapses, the one that sent out the signal, will reabsorb some of those neurotransmitters because they're like, oh, well, if you're not using them, then I'll take them back. But what that does is it blocks those neurotransmitters from being reabsorbed. So then that way the signal gets sent again, or it strengthens that signal. And so it does take a little while to work, but what the research found is that it ends up helping to change the neuron, and it grows more dendrites to absorb more of those neurotransmitters of like serotonin to help relax you, or norepinephrine if you're depressed to try to increase or uptake your activity of adrenaline. So if you have someone who just is anxious, you don't want them on an select or serotonin and norepinephrine reuptake inhibitor, because obviously your norepinephrine is going to increase and then therefore make you more hyper or anxious, where your selective serotonin is more of the good feels, tries to relax you. So if you're just anxious, you want to be on a selective serotonin reuptake inhibitor. If you're anxious and depressed, then you want to be on the serotonin and norepinephrine reuptake inhibitor. So that's how those two differ. So the good thing about creating these new thought processes is that then it can allow you to change how you think about things, and then therefore be able to deal with some of your anxiety and depression. It does take 2 weeks to work because, again, you're growing those dendrites. But remember how I said serotonin is seen a lot in our digestive tract. Well, serotonin, if messed within the medication, can cause dry mouth. So that's something to think about, that when you're dealing with anxiety people, you just need to make sure that they're not getting too much dry mouth. Otherwise, they need to maybe look at changing their medication. And the other thing that you need to remember is that if someone's taking medication and they haven't bothered to work on themselves or done any therapy, the reuptake inhibitors are kind of like fertilizers. So roses can grow if you're working on thinking positively, but so can weeds. So if you've always had a negative thought pattern, you can increase that negative thought pattern with the medication because you haven't bothered to work on yourself. So the medications can only do so much. You too have to do some of the work. And then finally, we have beta blockers, or I like to call them Betty blockers. And all of these end in LOL, or laugh out loud. So that's why they correlate, because Betty always tried to make us laugh, I think. But a lot of the time, your patients are always like, oh, I'm on that lol one, or metoprolol lol, or, and they try to say that. And so in your head, it should make you laugh. But then you can think, oh, they're on a beta blocker. Now, this doesn't necessarily reduce anxiety, but it does reduce the symptoms associated with anxiety, and therefore makes it to where then your heart rate doesn't increase. And that's why they use it for heart medication with people, because they want their heart rate to be level and steady. So what this does is it blocks basically adrenaline from getting into the body. And so by blocking it, it doesn't necessarily stop you from having your anxiety, but it blocks the symptoms or the physical symptoms that you would feel with that. And so therefore it does reduce your blood pressure. It's not addictive, which is good, but helps in reducing those stressful symptoms. So the problem with LOLs is it can cause dizziness, nausea, like the other ones. Long term, however, it can be a little bit of a physiological dependence because of the fact that if you're constantly blocking those adrenalines, then your adrenaline is probably going to uptick just a little bit. And so therefore you'll have to increase your medication. And if you stop abruptly, then it could resemble anxiety and you could have a chronic anxiety attack because if you're taking off your meds too soon. So Betty White's not a fan of that, but she'll get over it. So again, the med summary is benzos and PAMs, good for situational experiences, but doesn't actually aid in your learning or rewiring. So again, more of a one-time thing than a long-term relationship. Your Enes and your Bettys, since they're older, they do have a little bit more stability and they are better in for longer-term relationships. So the Enes and the Rams promote the ability for neuroflexibility and help you change your underlying anxiety. And then Betty blockers don't necessarily facilitate or impair rewiring process. They just prevent the symptoms that you may be experiencing with your anxiety. So a dental professional's role, we're the ones that create those relationships. We help to create change within our patients. We also then end up having to adapt a lot to these personalities that come in order to help them. But we kind of need to understand how their thought process is working, and we have to understand ourselves and them. So if you have what we call these 911 patients, where they're like, I need a pillow, I need a blanket, you need to do frequent suction, I need, topical, TV turned down, don't pull me too far back. All of those are forms of control for their anxiety. And so we'll kind of work through on how to make them realize that what they're doing as far as being over controlling isn't necessarily going to help their anxiety. And so we, one, need to create boundaries. People with anxiety have a hard time setting limits or saying no. So even we as dental professionals or hygienists have a hard time saying no. That's some of our anxiety coming through. But we need to remember that if we constantly give in to people, then we're not empowering them and allowing them to use their tools to achieve their goals. So we don't want to enable, and setting boundaries is actually part of self-care. Now, some of you may be worried that it's like, well, if I'm doing this, they might view me as being selfish. Well, anybody who can view themselves as possibly being selfish doesn't actually lack the capacity to even entertain that thought. So you're still having boundaries is healthy, and it's not considered selfish as long as you can actually think the thought of being selfish. I know that's a little bit of a twist of thoughts, but so what we need to do is we have to create trust within us and our patients in order to kind of create a change in behavior. One way is to take the time to prove it, which sometimes can take a long time, but usually those hygienists or dental professionals that have been there longer usually have already created trust because they've been there. They've taken the time to prove it. The other version, if you want to speed it up a little bit, is you have to go beyond what you're asked to do with your patients. Now, a lot of the people with the blankets and the pillows and laying back and whatnot, that's to a form going beyond what you're asked, but it's not in the way that's helpful. So again, we're going to talk about that. So this is an example of there was a patient that I had who was on escitalopram, and he was around the age of 16. Now, escitalopram, since it's PRAM, it's RAM, so I knew it was an Irene. So I'm like, okay, he's on a selective serotonin reuptake inhibitor, but he was acting a little depressed. And so I went to the front desk and I was like, do you guys have his number? I felt like I didn't necessarily talk about his issues. He said that he wasn't feeling, very well, not in the extent of feeling sick, but just feeling down. And I'm like, maybe he needs to change his medications. But I'm like, well, I need to reach out to him and just let him know that if he needs anything, I'm here for him. And I didn't hear anything for about a month or so went by. And then finally I got a text message back and he's like, thank you for reaching out. That text message you sent was to my mom. And of course I literally panicked because I'm like, oh my gosh, are you kidding me? Like I go get the record of his phone number and I end up sending the text message to his mom. So of course my response was, oh my God, I'm so sorry. That was not my intent. I apologize. And we will fix that in our records. But then what he says is, it's okay. It allowed for us to start a conversation that I was avoiding. It really helped. Thank you, which is what I wanted to say. And so, of course, I said, you're welcome. Again, if you need anything, let me know. And he's like, thanks, man. So this was someone who I went above and beyond to help him, obviously not in the way that I wanted to, but it worked out for the best. And it allowed for then him to become a long-term patient with me because I developed that trust and went beyond in order to help him because he was suffering from depression as well as his anxiety. So I also have this where you can have hotlines, just print it out, or you can take a picture of it. But it's always nice to have this. So then that way, if someone needs to reach out to someone, you're giving them the tools that they need to in order to help with that. And if you're wondering what the SAMHSA is, it's Substance Abuse Mental Health Service Administration, to help those with substance abuse. So we want to relieve the anxiety. And some of the time you can do that with emotional intelligence. So we have personal competence. Emotional intelligence is an EQ, as they call it, not an IQ. IQ never changes. You're as smart as you are going to be, but your emotional intelligence will always change. Your EQ can always increase by the amount that we learn from other people. So personal competence would be self-awareness, is understanding our own emotions. So if we get a feeling, we need to realize that, like, oh, I know what that emotion is. I'm obviously not dealing with something. And I've learned that anger is a secondary emotion. So if you're angry at something, there's always something else that's underneath that. Anger is a secondary emotion. So it's easier to express anger, but anger isn't the cause or the root as to why we're angry. So that's a self-awareness. And then self-management would be, understanding those feelings and then choosing the best course of action in order to know how to deal with it. And then social competence, of course, is your social awareness. So your ability to pick up on emotions in others, and knowing what to do with that. And then, of course, then your relationship management is recognizing those emotions in yourself and others, and then using constructive ways to communicate your emotions. So this is how I use emotional intelligence. A lot of the times, people who have high anxiety will usually tell the front desk, especially if they're a new patient, I'm very anxious, and so they want to make everybody know that they're anxious because they want you to help them, or that's their way of verbalizing to help them. So I usually like to have the front desk send this to them in their email and have them complete it before they come, because one, it's self-awareness. So I'm trying to grow their emotional intelligence of, well, what is it? Or what happens when you think about the dental office? What feelings are present in that moment? And then it's like, what can you do to make the visit easier on yourself? And then self-recognition is, well, what can I do to calm myself down? Like maybe they can bring their own headphones, if it's the noise and they realize, oh my gosh, it's the noise that I don't like, and that can help them calm down. Or if we end up having a discussion, it's like, what can I do to help myself adapt to new situations? And then finally, motivation is, it's like, well, what am I hoping to accomplish? You need to give them a reason to create these changes. And so that's why you tell them about the motivation that they can do, or the reason that they showed up in the first place. So time to ask, we need to figure out what their triggers are to that anxiety. Is it the anesthesia, or is it the unknown? Thinking about the pain, you have to get them to verbalize it, because like I said, the amygdala is an emotional memory. And so our language is in our cortex. And so if we learn to say what the anxiety is, then that emotional memory can finally get into the cortex, and we can actually learn then how to manage that anxiety. But you can't do it if they don't verbalize what it is that they're anxious about. So the different types of dental anxiety pathways, there's the Pavlovian condition, where most common is when you experience pain, just like the Pavlov's dogs, when they hear the bell and then they salivate. So then you're negatively impacted by future dental experiences because of what you have already experienced. Then you have informative pathway, which is indirect. So it necessarily affect you, but you were indirectly told about it by others. Then you have vicarious conditioning, which is the indirect pathway to phobia by observing the response of others. So whether that's like a sibling or something and they freaked out, so then now you vicariously freak out yourself. Then verbal transmissioning is hearing or reading about threatening information, creating fear. So this one I like to think of as like root canals, because everybody always has fear. They read online of something and, then they fear the root canal, even though they've never had it themselves. And then parental pathway is, of course, when you have a parent, that's always like, oh my God, I have so much anxiety. And then the kids see that, and then they're indirectly affecting their child, where you kind of want to push them out the door to be like, no, I'm going to deal with your child. Can you not step in right now? Because you're not helping. And then, of course, the cycle of dental fear is they have dental anxiety, then they delay or avoid dental care. So then, of course, that results in the deterioration of dentition or poor health. They become ashamed of that or feel guilty. And so then they're like, okay, no, I need to go. I need to get it fixed. And then, of course, the anxiety comes back and they delay and avoid again. So the delaying and avoiding obviously is a bad or unhealthy coping mechanism, because they're withdrawing, procrastinating, even sometimes drinking. So I procrastinate sometimes, I withdraw, and I've drank before too. I mean, who hasn't? But I do recognize that in myself and know when to stop, or be like, okay, I'm withdrawing or I'm procrastinating, so I just need to get on it. But other healthy forms, so I've heard, is exercising, talking to friends, breathing, smiling, is another strategy. And you're thinking like, smiling, why would I smile? Because neurons that fire together are wired together. So when you smile, it actually helps put you in a better mood, because those muscles are linked to good feelings and they activate those nerves in your brain to release dopamine or serotonin when you're smiling. So if your coworkers are wondering why you're smiling like an idiot, just tell them you're trying to deal with stress, and so you're releasing serotonin. Okay, and then we need to break the habit loop. So like I was talking about with the verbalization, once they verbalize it, then it's gone from being unconscious to conscious. And so we have to map it out. So usually I say trigger, behavior, and result. So what is the trigger? The trigger might be the thought of the needles, and the pain associated with that. So the behavior that happens is that then they start avoiding the dental practice. Well, the result of that is oral health gets worse. This sounds simple, but the thing is that a lot of people don't think about the consequences of their actions. And so another one would be starts to struggle with something that you're working on. So then your behavior is, well, I can't do it. So then you either give up or you increase your results of the likelihood of you not being able to do it. So in order to break the habit loop, sometimes it helps just to map it out. Something that they teach nursing students is called the Jacobson progressive muscle relaxation technique. Now, I use this on patients that are gaggers. So I'll have them tense up a muscle group, whether it's their hands, I'll have them like clench in a fist, or I'll have them like flex their quads or raise their feet, which kind of does the same thing. While I tell them to bite down on the x-ray. So then that way they're using up some of that cortisol energy. And then once I take the x-ray out, then I tell them to relax for about 10 seconds and focus on that relaxation. So that way, one, it kind of distracts, but two, it kind of uses that energy that the anxiety has created in order to help them relax and be less gaggy. It works actually pretty well. Another one is enhancing control by tell, show, do. So this I use a lot on kids, especially if you have to do sealants. Now, Voco uses Grand Seal or Grandio Seal, and this is also what I use. Now, I don't necessarily use that because Voco is sponsoring this. I used it because I've tried other products, and this is, in my opinion, what I like because of the fact that it reduces my anxiety. So with kids, of course, you have to tell them the behavior, you verbalize it, then you show them. So you demonstrate and be like, cotton rolls go on either side, you put the blue paint on and then the sealant material, and then you obviously do exactly what you say. Well, with the Voco Grandiose Seal material, I went from doing sealants like this, where you're trying to brush it in and get it in there as fast as you can, to having a more accurate sealant material that actually fills in to the spaces that need to be filled. And then it actually then lasts longer because it has low shrinkage for high marginal tightness. It also has fluoride releasing particles, which I love. And then it has a high wear resistance. So instead of just flooding it with a sealant, you can actually push in the sealant into the proper areas. And I have a lot more confidence in it. So I really, really love that. Again, their anxiety reduces as well as the practitioner's anxiety reduces when you have good products. Another one is sensitivity. So sometimes people's anxiety is result from sensitivity. Now you can use topical. I use topical all the time. I have it ready whenever I need it. Put it down in the sulcus or whatnot. But if someone is saying that they are uncomfortable, we need to listen because, again, pain is a good responder to causing those anxiety memories or emotional memories. And so the other thing is that you can also use Amira Protect by Voco. I love their single application because you can paint it on that area of recession that you see there, seal it with the light, and then you can either go about cleaning. So then that way, if you actually spray water, they're not like jumping out of their chair. And you can use the D9910 desensitizing medicament. Now, is this covered by insurance? No, it's not. But that's a discussion that you can have with them to where you can say, hey, I can get you out of pain or discomfort if you allow me to put this on. Now, it may not be covered by insurance, but I guess that's up for you to decide. Is the $30 that we're going to be charging today worth the pain that you won't feel? And a lot of people usually decide to go with it because they're like, yeah, no, that's fine. Put it on there. It's great. So that's just something, again, where I use a managerial and consulting to help people increase their own production through using helpful additives for individuals. Another thing is that I created the Rutar meditation toothbrush technique. I noticed that I wanted my patients to brush a little bit better, but I needed to find a way for it to be something exciting and habitual. And then also I was studying this anxiety aspect and the different brain waves within the brain. And I noticed that it said that meditation is very important. Well, if we close our eyes, we actually decrease about 80% of exterior sensory within our world. And so it actually lowers our brain waves. And you might think like, oh, that's weird. Why would I want to lower my brain waves? Well, the thing is that if our brain waves are too high and overactive, it can cause things to become out of balance. And that's what stress basically does. So I usually tell my patients, hey, I want you to use your electric toothbrush and I want you to close your eyes and focus on how the brush feels and where you're at on the teeth and making sure that you have the right direction and angle, because of course we go over those. But basically within that 2 minutes, you end up going from a high beta wave to a low beta wave, which then creates relaxation. And with focused meditation actually allows them to brush better and look forward to brushing their teeth in the morning to like slowly help them wake up. And then also right before they go to bed, it helps them to lower their brain waves to help them then fall asleep and be more restful. So something kind of cool. And then, so these are different ways to practice helping rewire the brain. You can face your fears, which is kind of what I've done. Don't always recommend it, but I mean, it helps as long as you have people with you. Practice gratitude or kindness, because obviously when you're kind to others, it helps release serotonin and dopamine. Treat yourself with compassion. So don't talk negatively to yourself, because again, we don't want to grow those weeds. Meditate, breathe in deeply, because again, that decreases the activation of your anxiety. Take breaks. Seek out therapy if you need it, and then be curious about your inner attitude. Again, that's the emotional intelligence about your thoughts, feelings, and sensations. Because again, our brain is very neuroplastic and can change just based on how we think and feel. So there's only two ways to influence human behavior. You can either manipulate it or you can help to inspire it. So one of the Pearl exercises that I like or tell people to do is pearls are made out of irritants that the oyster notices, and then it starts to surround it or the sand in order to make this beautiful, serene pearl that's more soft and beautiful, obviously. And so I kind of tell people, well, think about your anxiety in your body, find where it's at. And then as you take in a deep breath, think of that deep breath swirling around that emotional constraint. Mine's kind of in my chest when I usually have anxiety issues. And so as I breathe in, I think of the swirling of my breath going around that anxiety pain that I feel in my chest. And then as I go to exhale, then I'm exhaling that pearl out with the discomfort in order to allow for myself to slow my anxiety down, but then also visualize the pain kind of leaving my body. So, of course, you want to make pearls. Again, I'm also here. I can help with coaching. We walk through different steps, but also I help try to empower dental professionals within their practice to be the hygienist or dentist that they want to be. I thank you for coming today, keeping an open mind and listening to what I had to say. And of course, the one thing that I always like to say is limitations are only made in our mind. So if we learn to push past our comfort zone, our possibilities become endless. So now I had some questions that they wanted me to look at. Oop, where'd it go? Let's see. There it is. Okay. So any questions? It looks like I just had someone that just said, I love the subject. Thank you so much for allowing, I guess, this lecture. Again, a lot of thank yous. I appreciate you all coming. Again, if you have any questions, you can email me, Ryan@pearlywhiteprevention.com. Yep, right there. I appreciate everyone being here today. And I hope you guys all have a great weekend. Go Huskers. I know we're ranked #1 in volleyball. Whoop, whoop. And that will be the end.